I had to stop 5 times crossing the Skyway to your office. He said, you know, this last month it got to be less and now it's completely gone. Don, back you go to the vascular lab. And now you see on the right, the repeat pulse volume was absolutely double. We now had suddenly rock solid, irrefutable, absolute scientific data that food and food alone could absolutely reverse vascular disease. And somebody's going to say, well, wait a minute. What about the statin drugs? Well, wait a minute. This study was in 1986 before statins came on board. Here's another. This is a 78-year-old retired high school chemistry teacher. And in his retirement, he and his wife loved to enter square dance contests. But he noticed that it was during the fast square dance that he would always get bilateral calf pain. Well, he saw the vascular surgeons who got the images you see here, and he was not very excited about the big operation that he proposed to help correct this. And so when he came to see us, he said, Dr. Esselstyn, how long, if I use your method, will it take me to get rid of this calf pain? So I looked at him with great wisdom in my face and said, probably about 10 months. 3 months later, I got a phone call from him. Dr. Esselstyn, you do not speak the truth. The pain is gone. Now, we all know that the penile artery is quite small compared to the coronary artery, and not infrequently before somebody comes down with heart disease, they will find that they are no longer able to raise the flag. However, all is not lost. Not infrequently, 10 or 12 months after I've counseled somebody, I'll get a phone call. Dr. Esselstyn, yeah, this is Mr. So-and-so. Fair enough. Good to hear your voice. Yeah, doc, really thought I ought to give you a call because recently something has come up, and I'm wondering if I don't owe you another check. Now, what you're seeing here on the left and on the right is a PET scan. And in a PET scan, if the heart muscle is orange or yellow, that's good. You got a good blood supply. But as you see on the PET scan on the left, on the right-hand portion of it, there's a patch of green. The green indicates what we call ischemia, poor blood supply. So I counseled him that day, I counseled him on the same day that he got the PET scan you see on the left. And we had him come back 3 weeks later to repeat the PET scan. And lo and behold, the area that was poorly perfused was now, as you can see here, the green is gone. Now, what is going on? I was not at all convinced that we had had a plaque or blockage wash away that quickly. And therefore, I went downtown and talked with Rodriguez, who is a Cleveland Clinic cardiovascular pathology chairman, who does about 200 autopsies a year from the deceased, looking at the heart. And I said, Rod, how often do you ever see, after the coronary artery has dived into the heart muscle, how often do you ever see in those intramuscular arteries any blockages or plaque? His answer, never. So now I knew what was going on. As you can see from this slide, you can see the three major coronary arteries on the surface of the heart. They're the ones that get all the publicity with stents and bypasses. And it was just to start on the left there, you can see the right coronary artery, the left anterior descending, and the circumflex. And then look what they do. They all dive into the heart muscle. You see these thousands and thousands of interconnecting vessels. Now, what seems to be happening, when we first see these patients, their endothelial cells are really pretty well beaten up, and they're barely making enough nitric oxide to dilate. And additionally, of importance, when your endothelial cells are so beaten up, they're your enemy, and they're making two molecules, endothelin and thromboxane, which are vasoconstrictive. So think about it. All those thousands and thousands upon thousands of intramuscular vessels that you see there, although they don't have a blockage or plaque in them, they are all constricted, narrowing, really decreasing the available blood supply to the heart. So it's really quite striking when you get these patients to change, especially the ones that have some degree of angina, how rapidly, often with 2, 4, 6, 8, or 10 days, their chest pain is markedly diminished, and in some cases, it's gone. Which really then you've got the patient hooked because they absolutely know for sure what they've done with behavior modification has made a difference, and they're elated and proud and pleased to think that they have been empowered as the locus of control to halt their disease. So let's summarize mechanisms of seeing disease reversal. You see reversal on an angiogram, on a stress test. We saw the PET scan reversal. Same thing happens with carotid ultrasound. Pulse volume of the leg showed that reversal. And the three symptoms of angina, claudication, and erectile dysfunction can be reversed. For those of you who haven't ever had a chance to come to the Cleveland Clinic, this is the A building. We're on the 8th floor. I was involved with surgery for a number of years, but I'd like you to see what the trees look like in February at the Cleveland. Yes. And I retired from surgery and was then rehired with my interest in nutrition and heart disease. And I left the A building, and I was then at the Wellness Institute, which has a much more modest budget, but the morale is still quite high. And one thing I've learned since the graduation from medical school 64 years ago, nothing is as important perhaps as brains and persistence, 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 best exemplified by this young damsel in Life magazine, striving to learn how to do the splits. But she stuck with it and stuck with it and stuck with it. And the other day, believe it was in Manhasset in Long Island, somebody spotted her and she had got it right. Thank you for your patience in listening. I would be delighted to try to answer any questions.